Hello, hi, this is Jay Rome. Welcome to Neb TV. Now, I made this video keeping some of my friends and some subscribers in mind who are going through the rigorous debate with these so-called conservative healthcare scholars. Really baffling. It is crazy.
As best as we can tell from the proposals on the table, here's what's going to happen. Within 90 days of health reform being signed into law, those who have been denied coverage because of some pre-existing condition will finally get a path toward coverage. They will have immediate access to care through high-risk insurance pools created by the government. That's first. If you can't get insurance now because of a pre-existing condition, you will get some relief within 90 days of the bill being signed. Another 90 days after that, it will be illegal for insurance companies to deny kids coverage because of their pre-existing conditions. Also, children will be allowed to stay on their parents' health care plans until they are 26 years old. Insurers will also be banned from imposing lifetime limits on health insurance benefits. Insurers will also at that point be banned from rescinding your insurance, rescissions they call it, taking away your insurance when you file a claim. All of this will happen within 6 months of President Obama signing health reform into law. Next stuff that happens as of the next calendar year, as of January 1st. At that point, if you're on Medicare, you will qualify for free annual wellness visits. Also at that point, insurance companies will essentially be required to spend 80 to 85% of what they take in from you in premiums on actual medical care. Imagine if they don't spend 80 to 85% of what you give them in terms of premiums on actual medical care, they will have to refund you the difference back. Also, if they want to hike your rates, they'll have to announce it. Then they'll have to justify it, and that apparent justification will have to be reviewed. They won't just be able to automatically, unilaterally raise those rates anymore. All of that happens as of next year. Then after that, after all of that, in 2014, it will no longer be legal for insurance companies to deny anyone coverage based on pre-existing conditions, period. So kids with pre-existing condition goes into effect very soon. It is by 2014 that it goes into effect for everyone. The health insurance exchanges at that point, for people who don't have coverage, will also be up and running by that time. And in addition to the ban on lifetime limits on benefits, which goes into effect shortly, insurers in 2014 will be banned from imposing annual benefits, annual limits, yearly limits on your benefits. So this is all those things I just described, this is all in motion. This is all happening
this year. Small businesses will start getting tax credits so that they can offer health insurance to employees who currently don't have it. Because this year, those same parents who are worried about getting coverage for their children with pre-existing conditions now are assured that insurance companies have to give them coverage this year. Because this year, insurance companies won't suddenly be able to drop your coverage when you get sick or impose lifetime limits or restrictive limits on the coverage that you have. Maybe they know that this year, for the first time, young people will be able to stay on their parents' health insurance until they're 26 years old. And they're thinking that might just be popular all across the country. And what they also know is what won't happen. They know that after this legislation passes and after I sign this bill, lo and behold, nobody's pulling the plug on Granny. It turns out that, in fact, people who like their health insurance are going to be able to keep their health insurance, that there's no government takeover. People will discover that if they like their doctor, they'll be keeping their doctor. In fact, they're more likely to keep their doctor because of a stronger system. It'll turn out that this piece of historic legislation is built on the private insurance system that we have now and runs straight down the center of American political thought.